update now on the vaccine rollout in the country. And for that conversation, I'm joined by Dr. Nicholas Crisp, and he's the Deputy Director General at the Department of Health. Dr. Crisp, a very good afternoon to you, and thank you for your time. If you could give us an update on how the vaccination process for the over 35s is going in the country and how that drive is affecting the entire vaccine rollout plan that was in place.
Good afternoon, Tammy, and good afternoon to your viewers. It's going beyond all expectations. We have over 1 million people in the age group of 35 to 49 who registered on our first day. It was rather exciting, and another 500,000 on the second day. And people continue to register, but they also continue to arrive at vaccination sites, even though the date for the vaccination of that age group was announced for the 1st of August. People are very enthusiastic and engaging, and we should be pleased that people want to vaccinate. So the reports from the field are that there are a lot of people coming and very peacefully waiting their turn. And yeah, generally we're very happy. We would like to ask the younger people to bring their parents and their grandparents with them, because we haven't reached all of the older people yet. And we really don't want to leave them behind, since they are the more vulnerable in the community.
As far as registration is concerned, what is the status regarding walk-ins? Can one go to any vaccination site and be vaccinated even though they haven't received any sort of message from government?
Yeah, so I think people confuse the terms. There's registration. Whether you walk in or whether you do it at home, you have to register. That's the start of your opening of your electronic record of your vaccination. So it's better to do it at home before you go, so that when you arrive at the vaccination site, it's very quick and you don't have to then start registering. So registration is a simple thing you do on your phone or your computer or through SMS. And you tell us in the health system that you exist. This is my ID number, these are my names, and this is my story of where I live and so forth, and my medical aid details and so on. So that's registration. Then there's vaccination. And there are two ways to be vaccinated. The one is to be scheduled. So if you wait after you have registered, when you register, you will get an SMS to say you are registered. Whether you are standing at the site or whether you're at home, you will get that message to say you are registered. Then you can wait and you can be scheduled, in which case you will get an SMS to say we've made an appointment for you at this time, at this place, and you are invited to come for a vaccination. So that's scheduling. And then there are the unscheduled. So all sites leave some space open for unscheduled people, and that's what we call walk-ins. And there are also, at the end of the day, sometimes people who, what we call no-shows. They don't arrive for whatever reason, couldn't find transport, it wasn't appropriate for them, they were ill, or whatever the case might be. And so those slots are also available for people who walk in. So all public sites allow for walk-ins. Some have more walk-ins than others in their schedule, because they are still scheduling older people as well. So all of them allow walk-ins. The private sites, some of them are quite small, and it's not feasible and not practical for them to have too many walk-ins. And we have seen or heard reports of some of them that say they're not accepting walk-ins, just purely because they can't handle the volumes, I think. So that's the situation with walk-ins.
So Dr. Crisp, we've seen and we've been hearing of the rollout using the Pfizer vaccine, which is the 2-dose vaccine. What is the current situation with Johnson & Johnson and the challenges that are being experienced with that particular vaccine?
Well, I think for Johnson & Johnson needed to get their whole global supply reorganized after the challenges they'd faced with the emergent plant in the United States. And with the rulings of the FDA, they had to destroy quite a lot of the stock that came out of that source environment. So it's taken Johnson & Johnson a massive global realignment to get themselves ready. And we are one of the customers in that chain. We are fortunate that Johnson & Johnson uses a local South African factory for its finish and fill. So, we are hopefully not too far on the logistics chain for that. But there are processes that have to be followed and commitments that need to be made. And we are hoping within the next few days to receive our next lot of Johnson & Johnson. Clearly, we've got the 1.5 million that were provided on the short expiry date basis to help us to recover when the problem was initially relieved. And we have allocated all of that vaccine to various programs and communities, and they are busy rolling out at the moment. So we are looking forward to more Johnson & Johnson vaccine doses in the not-too-distant future.
And what are the time frames here? When is the not-too-distant future?
Well, I would love to tell you, but I think that we don't know the actual date. But certainly we are hoping that by next week we have that vaccine available to us to use.
There's the issue, Dr. Crisp, of the violence, the stealing and the looting that we saw in Gauteng and KwaZulu-Natal last weekend. Pharmacies were raided, reports of the vaccines also being stolen or destroyed. Have you calculated the loss there and the impact that that is going to have on the availability of vaccines? How dire is that?
Yeah, Tammy, you see, there's the financial impact, and then there's the systems impact and the loss of opportunity impact. And all of these things are an embarrassment to our country, and it's really sad what happened. But in terms of what we missed was probably around as many as 300,000 missed opportunities for vaccination, because the public and private providers in KwaZulu-Natal had geared up to a very significant tempo. And that obviously a brake was put on that, and for those days they were not able to vaccinate. So that's one loss. And they will do their best to catch up, and we will help them to catch up. The second loss is some vaccine was lost. There were reports of a warehouse that was raided, and we saw the pictures of some pharmacies being trashed, and in some of them there was some vaccine. Fortunately, it's not vast quantities of vaccine, but there were some vaccine doses that were lost. But the capacity of those vaccination stations has been lost as well. And that means we've had to repurpose and move people around. And I must say, the individuals involved at the vaccination sites and across the province have pulled out all stops and really got themselves going again in a very short space of time. So they've been asking us to send them more vaccine, and we will do our very best to make sure that KwaZulu-Natal and the people of KwaZulu-Natal don't lose out because of what's happened. There were, of course, a few places in Gauteng as well, but that has been more sporadic and so easier to catch up with what has happened in Gauteng.
The report at the moment, Dr. Crisp, is that the Western Cape and Gauteng seem to have reached their peak. But should we be expecting a surge in the number of COVID-19 cases perhaps in the next week or two? And I ask this in the light of the mass gatherings from the lootings that we saw in Gauteng as well as KwaZulu-Natal.
Yeah, look, I think it's a big worry. Mass gatherings of any form are an opportunity for the virus to spread. So just on common sense, we would expect to see that there are a large number of cases. Exactly what that peak might look like and when it might come is hard to anticipate. But yeah, in any event, that is one of our major concerns at the moment.
Any reports of side effects from the vaccinations?
I think all vaccines have some side effects, but fortunately they are minor. We participate in the global reporting on side effects, and we have a very good reporting system in South Africa for all vaccines, not just our COVID vaccines. We are at the moment busy trying to put together a dashboard so that the public can also see what's being reported, and because that will help people to calm down and see that the vast majority of what is reported is very minor indeed. And from time to time, we know from the international literature, and there have been a few cases in South Africa of more serious side effects, and those are investigated to check whether there's in fact causality. In other words, whether it's the vaccine that's causing the event or the injury, or whether it is something that has just happened to happen at the same time. So there are very clear global protocols, and we follow those global protocols on how to do this.
And just before I let you go, reports coming out of the United States of neurological implications or neurological side effects from Johnson & Johnson. You were talking there about a global watch that you have. Your response to those side effects and those symptoms?
Yeah, we've seen the reports as well, and obviously that also comes out of the same sort of reporting systems that we have here. And we are aware, and they've monitored here. We haven't seen those side effects yet that I've seen on the reporting, They are rare events, much like we heard rare events of blood clotting and other side effects. And one has to see it in context before one really gets worried about it. There are very, very few of these side effects, but they have now included it in the warnings.
Dr. Crisp, thank you for that vaccination update this